Hey, how's it going? This is Saman here from All Things PT, and in this video I'm going to go over some exercises that you could do for your hip bursitis. Now, before we go too far into the exercises, let's go over the anatomy first. So obviously this is going to be your hip muscles, and there are mainly two things in question that causes your pain, okay? This is going to be a TFL that continues as an IT band, followed by the hip bursa right here. And the job right here of this hip bursa, it goes right on top of this bony landmark of the hip, really big spot here called greater trochanter. And the job of this bursa is to sit right on top of this greater trochanter, and it's a sandwich in between the IT band and the greater trochanter, and the job is to provide cushioning. Okay, if the bursa wasn't there, then what would have happened is that anytime the IT band moved, it would rub against the hip and eventually cause muscle tear. However, there are butt muscles, right? Your glute med, glute max, and glute min that are attached to either the IT band in the case of glute max, or the glute med or glute min that are connected to one way or the other to the greater trochanter. And what happens is when your glute muscles are weak, right? The job of the glute muscles is to either kick the hip back, or it is to kick it to the side like that, or it is to stabilize the hip. So what happens, I'm just going to zoom this guy out. Okay, so what happens in this case, if say you are taking a step and you are taking a step with the right side, okay, if the hip muscles right here, the glute med, they are not strong enough, what's going to happen is as you take a step, it's going to drop. So this hip drops, okay? So same way, if the left hip is weak and you are taking a step, it drops, okay? So how it looks like when a lot of people, and you can see that when you're walking or whatever, is a lot of people when they walk, they have like a catwalk like thing, like a stage walk like thing, right? And that's primarily caused because of the weakness of the glute med. And so that keeps happening. What happens is this bursa that was in question, that gets rubbed much more, right? This gets stretched a lot more when this hip drops like that, and this causes inflammation and pain in the bursa because of all the rubbing and stretching and compression against that bursa because of the hip moving this way, okay? So before we even begin, let's talk about, so when that happens, there are a lot of people that will do stretches of the IT band. They will do some foam rolling over the IT band. They'll do some foam rolling over the glute med and stuff like that, which is okay. It's going to give you temporary relief, but until and unless you fix that hip drop, which is also called the Trendelenburg gait, until and unless you take care of that, your hip issue is not going to be solved, okay? So you really need to strengthen your glute med. And the exercise that I'm going to show you is not something that you do all of it in one day, but rather you do, say, exercise number 1, you do it for a couple of days. You want to see how your body reacts to it, and while doing this exercise, if it doesn't create more pain, then you move on to the next exercise. So these are basically progressions from one exercise to other, rather than doing all 5 or 6 exercises I'm about to show you in one session. Now, before we talk about some of the exercises, let's talk about some signs and symptoms, as well as some confirmations tests, okay? So first of all, if you have a hip bursitis, you are going to have pain in that greater trochanter area, which is kind of like right here in this area. You can kind of push on it and really feel the pain. The second, you'll have a lot of pain when you are standing up from sitting, as well as you will have pain going up and down the stair, especially when your involved side is leading, okay? Third, you can do a confirmation test where you are on your back like this, okay? And then what you are going to do, you are going to lift this leg up, the affected leg. you're going to bend the knee and you're going to put it all the way behind your body like this, and then you are going to turn this inside. Okay, so you're going to lift this leg, go back, bend your knees, and twist it in. If you can't hold the position, or if you can't even get into that position without pain, chances are you have hip bursitis. To do these exercises, you need two equipments. First of all, you are going to need a band, and these are the elastic bands. Takes about $10 or so. You get a couple of resistance, which is really good because as you get better with these exercises, you can choose different resistance. You also need a belt, and this belt is only useful at the very beginning of the exercise, especially if you are very flared up. Okay, the first exercise I'm going to show you is going to be an isometric, and every exercise we're going to do is going to target that glute med so that you can stabilize your hip while you're walking and doing stairs and stuff like that without flaring it up. Okay, you're going to lie down on your back. You're going to tie the belt like I was showing right above the knee, and then you are going to push the belt that way. You're going to hold for about 5 seconds. Really feel these glute med firing up right here, and you're going to hold for 5 seconds and relax and push out. Hold for 5 seconds and relax. Put your mind and muscle to it, right? And really feel these muscles working. You're going to hold. And this is again only at the beginning when you have a severe flare up. You're going to put only about 50% of the effort while doing that. Now, once this exercise is no longer painful, you are going to progress to a different exercise, but the same version. Okay, so that one was isometric. Now we are introducing some movement to it. Okay, so you're going to tie the band just above the knee, just like in the video. The yellow band right now is too easy, but this is one that was available, so I'm just grab that. So same thing, you're going to feel your glute med working, and you're going to push against the band. And now you're going to take the range to as much as you can, and then you're going to hold for a few seconds at the end range and relax and come back. Push out, hold for a few seconds and come back. Hold for a few seconds and come back. So once this starts to get easy, then you're going to go on your side like this. Okay, again, it's a progression. Don't do all of them on day one. Okay, what you're going to go on your side like this, and you're going to lift this knee up. Again, the muscles working is the same, so you should be feeling the muscles on your glute med really firing. Okay, so up and down. On this one, initially you can hold for a second or two up top, and then as you get better you can hold 5 seconds. Okay, what we want is only the hip muscle working. So if you're doing it correctly, you won't be able to go very high. Now once you start twisting your spine, you can go a lot more, but we are not doing this, right? We are not twisting from the spine. You only want the hip to work, not the whole spine. Okay, so let me show you from a little bit different angle too. You want this, not this. Okay, so after you're done with that, you're going to progress on this exercise now. And what you are going to do, say my left side is the one that is involved, you are going to put the band like this way, like I am showing you. And you can do this exercise without the band. If putting with the band is too hard, you can go up like this. So now the key is that this leg should be in front of the, either on line with the body, or it needs to be even better if it's behind the body. Okay, what a lot of people will do is they will bring it here like this because it's easy, and they will do things like this, and that's not wrong. I mean, that's not correct. Okay, because you'll be working your hip flexors, whereas you need to work your glutes. So you're going to keep your leg back. Oops. You're going to keep your leg back and go up and down like that. Same thing if you are twisting from your back, you will do things like that or whatever. But if you're doing them correctly, you won't be able to go very high, okay? Just back and forth. You should really be feeling this burning. Now, if all these are okay, you are going to go with some squats. So what you're going to do, you're going to tie the band just above the knee, okay? You're going to we are going to push the band out, and you're going to maintain that as you go down slowly. Okay, so let me show you from here. Push the band out, shove your butt back, hold for a few seconds, keep pushing that band out, and then come on up. Same thing, push the band out, hold for a few seconds, down. The key is to maintain that position and focus on the hold and focus on the lowering down part. Anything that has to do with the things like bursitis, tendonitis, anything that ends with itis really works good with eccentric loading and isometric loading. So both eccentric and isometric. So really focus on lowering down slowly as well as holding. You kind of want to really focus is as you go down, your knee doesn't cave in. Okay, that'll be the other part. Make sure it's out as you go down. Okay, and that's it. These are, I think, 4 or 5 progressions, maybe 6, that you could do, and that could be the only exercise that you do, right? But it's going to tremendously help with the hip bursitis. So hopefully this video helped. If it did, please make sure you hit the like button. It really helps me. Subscribe to my channel. More videos coming soon. I'll see you guys next time. Bye bye.